First, tonight we are on top of the coronavirus epidemic. So far, almost 130 people in 16 states are infected, with the biggest concentration still up in Washington state. This is KOIN 6 News at 4 o'clock. I'm Jennifer Hoff.
And I'm Dan Tilkin. The number of people in Oregon who have tested positive for the virus remains at 3, with 2 people in Washington County on that list, along with a person from Umatilla County. We heard from leaders earlier today who told us Oregon is processing 80 coronavirus tests a day right now. They say the state has 1,500 coronavirus test kits. Meanwhile, Washington's Department of Health is tracking 39 confirmed cases, along with 10 deaths. And we know this afternoon, Vice President Mike Pence is planning to travel to Olympia tomorrow for a meeting on the coronavirus with Governor Jay Inslee. Inslee says the state needs help with testing.
Will require the private sector to help out in this regard. So we are talking, and the federal government is talking to private labs to increase their capacity as rapidly as possible. We can use a lot of federal coordination on that to be able to approve their operations.
We'll be bringing our team with us to further coordinate and ensure that we are giving all support necessary to Washington State's efforts there.
Congress has approved about $8 billion to combat the virus. Here in Oregon, Governor Kate Brown held a Facebook Live conversation in her office today, along with the Oregon Health Authority director and the state epidemiologist. Our Lisa Balick was at the governor's office. She joins us live from Salem with what they had to say.
Well, today we learned that there are more than 100 people who are being monitored. Now, they're not sick, but they're being monitored for the virus to see if they develop any symptoms. So far, they told us today there are no children who have come down with the virus. Now, Governor Brown read questions today in a Facebook Live event at the Capitol. The health leader she had gathered with her said most people who get the virus get mild flu-like symptoms and do not need hospitalization. There were also questions such as why health leaders are not sharing all the locations of where those with the virus had been before they were diagnosed here in Oregon. State health experts say the risk is not the same as it was with measles.
Measles is highly contagious, probably 5, if not more times contagious than this virus. And so if someone's in a large room and leaves, that virus can stay in that room for up to 2 hours after the person leaves, and anyone who is in that room who's not immunized, who hasn't had the vaccine, may potentially come down with the disease. COVID-19 really requires more close contact. A person coughs or sneezes, those droplets come out, and those usually spread within about 6 feet. So if someone's within that 6 feet, they're potentially exposed, but if they're washing their hands and not touching their eyes and nose, they're going to be safer.
Now, Dr. Seidlinger says basic household cleaning products do work to remove the virus from surfaces. State health workers are reaching out to people who have been in close contact with patients who are diagnosed to have the virus, to have them self-quarantine and monitor for symptoms such as coughing and difficulty breathing. Now, I asked the experts there today, what would they do in terms of, would they get on an airplane right now? Do they still make a lot of contact with the public? I'll have their answers coming up tonight at 5. Live in Salem, Lisa Balick, KOIN 6 News.